You take calcium tablets every day thinking you're protecting your bones. Well, I need to tell you something that might completely change the way you think about your bone health. My name is Finley Crosden. I'm a rheumatologist with over 20 years of experience, and every week I see patients who did everything right, followed all the medical advice, took their calcium tablets religiously for years, and still ended up with serious problems. Not in their bones, in their arteries. That's right. The calcium that was supposed to go to your bones to make them strong, to prevent fractures, ended up in completely the wrong place. And this is far more common than you might imagine. In fact, millions of people are doing exactly this right now, taking calcium the wrong way, not knowing they could be damaging their heart while trying to protect their bones. And look, I'm not here to scare you. I'm here to give you information that most people simply don't receive, because when your doctor prescribes calcium tablets, they usually don't explain what can happen if you take it the wrong way without the partner nutrients that make this calcium go to the right place. You know what happens? The calcium you swallow in tablet form enters your bloodstream really fast, much faster than calcium from food, and then your body gets confused. It doesn't know exactly what to do with all that calcium at once. And when the body doesn't know where to send the calcium, it just deposits it wherever it can, on artery walls, in heart valves, in kidneys, in places where it shouldn't go. So if you take calcium tablets, or know someone who does, stay with me until the end, because I'm going to show you how to do this supplementation intelligently so the calcium goes to your bones and not to your heart. You probably started taking calcium for a very simple reason. You reached a certain point in life, got a bone density test done, and the result wasn't good. Osteopenia, maybe even osteoporosis. The doctor looked at the test, looked at you and said, you need to take calcium. And you did what any responsible person would do. You went to the pharmacy, bought calcium, and started taking it every day. Calcium 500 millibars, 600 milliliters, sometimes even 1,000 milliliters per day. Because if it's meant to strengthen bones, the more the better, right? Only nobody explained one crucial thing to you. Calcium in tablets works completely differently from calcium in food. When you eat a piece of cheese or yogurt, the calcium enters your blood slowly, gradually. Your body can process it, distribute it, send it to the bones calmly. Now, when you swallow a concentrated calcium tablet, especially those calcium carbonate ones, which are the most common, you're throwing a calcium bomb into your bloodstream all at once. And that's where the problem lies. Let me tell you about Martha. She's 71 years old and came to my office on a Thursday morning. I remember she walked in with a folder full of tests under her arm, shoulders a bit hunched. That way someone carries when they have a heavy concern. She sat in the chair, put the folder on the desk, sighed deeply and said, "Doctor, I don't understand. I've been doing everything right for 8 years. I take my calcium every day, never miss it. Not even when I travel do I forget. And look at my bone density results. It's barely improved at all. 8 years taking it religiously, and my bones are still weak." But that's not even the worst part. She opened the folder with slightly trembling hands, took out another test, and placed it in front of me. It was a coronary calcium score. You know what that is? It's a special CT scan that measures how much calcium is deposited in your coronary arteries. The more calcium in the arteries, the greater the risk of heart attack and stroke. It's a test that many people don't even know about, but it reveals very important things about cardiovascular health. Martha's score was 347. To give you an idea, a score above 300 is already considered high. It means her arteries had significant accumulation of calcified plaques. She looked at me with tears in her eyes and asked, "Doctor, how is this possible? I took calcium to strengthen my bones and it went to my arteries. This was exactly what I wanted to avoid. And now I have cardiac risk?" I looked at her and explained, "Martha, the problem isn't the calcium itself. Calcium is essential for your body. The problem is how you took it and what was missing along with it." And then I asked, Are you taking vitamin K2 along with the calcium? She looked at me confused. Vitamin K2? Nobody ever told me about that. They only prescribed calcium and vitamin D. And that's exactly where millions of people make the mistake. They take calcium. Sometimes they take vitamin D along with it, which helps absorb the calcium. But without vitamin K2, there's nobody to direct this calcium to the right place. Let me explain in a very simple way what happens inside your body. Think of calcium as building material, bricks, let's say. Vitamin D is like a delivery truck. It picks up the calcium bricks from the intestine and puts them into your body, into the bloodstream. But loose bricks don't build anything. You need masons to put these bricks in the right place. And vitamin K2 is exactly that. It's the mason. It activates special proteins in your body that take the calcium and lead it to bones and teeth, which is where it needs to be. One of these proteins is called osteocalcin. It's responsible for taking calcium and fixing it within the bone structure, literally incorporating the mineral into the bone matrix. Without vitamin K2, osteocalcin is inactive. It exists in your body, it's circulating there, but it can't work. It's like having a mason at home without tools. The mason exists, the bricks exist, but nobody can build anything. And there's another very important protein called MGP, which is matrix Glar protein. This protein does the opposite job. It prevents calcium from depositing in arteries and soft tissues. It works like a security guard standing at the door of the arteries saying, "Not here, calcium, go to the bones." It's a protective protein for your arteries, a guardian that keeps them clean and flexible. But guess what? MGP also needs vitamin K2 to function. Without K2, it's deactivated. And then calcium enters the arteries without any resistance. A large study called MESA, which followed over 5,000 people for 10 years, showed something very interesting. People who had high calcium consumption through diet had 27% less risk of developing arterial calcification. But, and here's the catch, people who used calcium supplements had 22% more risk of arterial calcification. And it doesn't stop there. Another study published by the American College of Cardiology showed that calcium supplementation, especially in doses greater than 1,400 mg per day, can be associated with activation of the coagulation cascade, calcium deposition in vessels, endothelial dysfunction, and arterial stiffening. All of this increases the risk of coronary disease, heart failure, and even stroke. And you know what's most concerning? Aortic stenosis, which is when the heart valve becomes calcified and stiff, affects 2% of people at 65 and 4% of people over 85. And one of the factors contributing to this calcification is precisely excess calcium circulating in the blood without proper direction. And this is what I need you to understand. Calcium from food behaves differently from calcium in tablets. When you eat foods rich in calcium like cheese, yogurt, sardines, broccoli, kale, you're ingesting calcium along with other nutrients, vitamins, minerals, fiber, everything together. And these nutrients help your body process and use calcium correctly. Now, isolated calcium in tablet form, especially in high doses taken all at once, creates calcium spikes in the blood that your body can't manage properly. This information you're receiving now is incredibly important. That's why I need you to hit that like button and subscribe to this channel. When you do that, you help this video reach more people who need to know this, people who are taking calcium thinking they're protecting themselves when they might actually be harming themselves. So go ahead, like and subscribe now. Getting back to the subject, so does this mean you shouldn't take calcium tablets at all? That's not it. There are situations where supplementation is indeed necessary. If you have advanced osteoporosis, if you can't get enough calcium from your diet, if you have some condition that impairs nutrient absorption, the problem isn't supplementing, the problem is supplementing wrong. And here comes the practical part I know you're waiting for. How to do intelligent calcium supplementation that strengthens your bones without calcifying your arteries. First, never take calcium alone. Formula with calcium, D3, K2, MK7. This triad works synergistically. Second, split dose, 500 mg morning, 500 mg evening, instead of a 1000 mg at once. Third, take with meals. Calcium needs stomach acid, more produced when eating. Fourth, prefer citrate over carbonate for better absorption, especially 60+. Fifth, prioritize dietary calcium. Half from food: yogurt, cheese, sardines, kale, almonds. Now let me tell you about vitamin K2, which is the real hero of this story. There are different forms of K2, but the one you need to look for is MK7. It has a longer half-life in the body, meaning it circulates longer doing its work. Studies show that K2-MK7 supplementation can reduce fracture risk in menopausal women by up to 60%, and simultaneously it prevents arterial calcification. It's a vitamin that protects both sides. The recommended dose of K2-MK7 is usually between 100 and 200 micrograms per day. You'll find isolated supplements or formulas combined with calcium and D3. In American pharmacies, a bottle of vitamin K2-MK7 costs between $15 and $30 and lasts 1 to 2 months. But wait, there's another player in this game we need to talk about: magnesium. Magnesium and calcium work like dance partners. One can't function properly without the other. Magnesium is a cofactor for over 300 enzymes, including those regulating calcium metabolism. Without enough magnesium, calcium deposits in the wrong places. Studies show the calcium to magnesium ratio should be about 2.1. If taking 1000 mg calcium, take about 500 mg magnesium. Most people are magnesium deficient. Stress, coffee, alcohol wash magnesium out. American soil is depleted. Best magnesium forms: citrate, glycinate, taurate. Avoid oxide, cheap but poorly absorbed. Good magnesium costs $10, $20 monthly. Worth it, helps calcium placement, relaxes muscles, improves sleep. By the way, for those who want to dive deeper into this topic of safely strengthening bones and joints after 60, I've left the complete guide to strengthening muscles and joints after 60 in the pinned comment. There I go into more detail about intelligent supplementation. If you're interested, check it out later. Now, where to find vitamin K2 in diet? Fermented foods are richest. Natto, a Japanese dish of fermented soybeans, is by far the richest in K2-MK7. A 100-gram serving of natto has about 1,000 micrograms of K2, but I'll admit, natto has a pretty unique taste, kind of sticky, with a strong smell that most Americans don't enjoy. More palatable alternatives include egg yolk from pasture-raised chickens, about 30 micrograms per yolk. Aged cheeses like Gouda and Brie, which can have 20 to 75 micrograms per 100 grams, chicken liver with about 14 micrograms per 100 grams, and butter from grass-fed cows. These foods contain K2, though in smaller amounts than natto. In America, I recommend aged cheeses from local dairies. Longer aging means more K2, sharp cheddar, aged Gouda, real Parmesan, all good. Sauerkraut and fermented pickles contain K2 from bacterial fermentation. Practical strategy: combine sources throughout the day. 2 eggs for breakfast, 60 micrograms K2. Aged cheese snack, another 20-30 micrograms. Quality butter with dinner. Accumulate K2 naturally. Remember, K2 is fat-soluble. Always eat with fatty foods: oil, butter, avocado, nuts. Drug interactions are critical. If on blood thinners like warfarin or Coumadin, be careful with K2. These drugs block vitamin K, so supplementation can weaken their effect. Always consult your doctor first. Blood pressure meds, especially thiazide diuretics, increase magnesium loss. Another reason to supplement magnesium: bisphosphonates for osteoporosis. Take empty stomach 30 minutes before calcium. Timing matters. Calcium absorbs best evening. Body needs it. For overnight bone regeneration, 11 p.m., 3 a.m. Take at dinner, if once daily. Magnesium evening 2 helps sleep. D. Morning or noon mimics sun production. K2 with D3 or separately with fatty meal. Want to know from you, do you take calcium tablets? Do you take it with vitamin K2 or just vitamin D? Comment below. I want to know your experience and your doubts. Body signals, calcium problems, night muscle cramps, classic, finger tingling, brittle nails, dental issues, joint pain, constant fatigue, subtle signs, insomnia, irritability, memory problems, hard to control blood pressure, irregular heartbeat, all related to calcium management. Interesting fact, the blood type can affect calcium metabolism. Type O people often have higher stomach acidity, helping absorb calcium carbonate. Type A has lower acidity and does better with citrate. Not absolute rule, but worth knowing. Now let me explain something else important. Some people will say, but I've been taking calcium for years and never had any problem. And that might be true. Not everyone taking isolated calcium will develop significant arterial calcification. It depends on various factors: genetics, diet, lifestyle, other nutrients you consume. Some people genetically direct calcium to bones better. Others have mutations making them susceptible to vascular calcification. ABCC6, MGP, GGCX genes affect calcium handling. Age matters. After 70, absorption drops 30%, less stomach acid. Kidneys retain calcium worse, skin produces less D. Postmenopausal women lose estrogen protection. Men have more vascular calcification after 65. But the point is, why risk it when you can do it right? Adding vitamin K2 isn't expensive, isn't complicated, and can make all the difference between truly strengthening your bones or creating a new problem while trying to solve another. And there's more. Many people take exaggerated calcium doses thinking more is better. Not true. Human body can only absorb about 500 milligrams calcium at once. Everything above is wasted or deposited wrongly. Daily calcium recommendation for adults over 50, 1200 mg, but don't supplement it all. If eating yogurt, cheese, sardines, you're getting much from diet. Factors: increasing calcium loss, excess salt, caffeine, cola sodas with phosphoric acid. No point taking mountains of calcium if losing it elsewhere. That's why the approach must be comprehensive. It's not just swallowing a pill thinking problem solved. It's adjusting diet, moderating the villains, ensuring partner nutrients, and supplementing intelligently. Now I want to return to Martha's story to tell you what happened next. When I explained all this to her, the first reaction was frustration. She'd taken calcium for 8 years the wrong way, but frustration doesn't solve anything. What solves is change. We made comprehensive adjustments to her supplementation protocol, reduced calcium tablets from 1,000 mg to 600 mg daily, introduced vitamin K2 MK7 at 150 micrograms, added magnesium glycinate 400 mg in the evening for better absorption, increased dietary calcium significantly. She started eating plain Greek yogurt daily for breakfast, wild-caught sardines 3 times weekly for lunch, organic sautéed kale as dinner side. It wasn't a revolution, just intelligent scientific adjustment based on evidence. 6 months later, she returned to the office with new tests. Bone density had improved for the first time in years. Not much, but improved. And look, for someone stagnant for 8 years, any improvement is victory. But most important wasn't even that. She'd done cardiovascular tests showing arterial function was stable without calcification, progression. Calcium score hadn't increased. Arteries hadn't hardened more. That, for me, was the most significant result. She told me with a smile on her face, "Dr. Crosden, I wish I'd known this before. I lost 8 years doing it wrong, but at least now I know I'm doing it right." And you know what? My neighbor also takes calcium the same way I used to. I already told her to watch your videos. She needs to know this too, and that's exactly why I do this work. because the right information at the right time can change someone's health trajectory. You have two choices now. First, continue doing what you've always done. Take your isolated calcium, ignore vitamin K2. Hope everything works out. In a few years, maybe you'll discover your bones haven't improved as much as they should, and maybe you'll discover your arteries are stiffer than they should be. Second choice, you make the intelligent decision now. Talk to your doctor about adding vitamin K2 to your supplementation. Adjust how you take calcium. Prioritize dietary calcium. Do things right. Imagine yourself a year from now with better bone density and a healthy heart, with stronger bones and flexible arteries, climbing stairs without fear, picking up grandchildren without worry. This is possible. Martha achieved it. And you can too. The difference between those who succeed and those who don't isn't luck. It's information. And now you have this information. Text this video to that friend who takes calcium every day, that person worried about osteoporosis, your brother, your sister, your neighbor, your walking buddy. You can literally change someone's life by sharing this now. See you in the next video soon. Take care of your health intelligently and wisely. Take care.